Hello and welcome. In this lecture, we're going to talk a little bit about timelines and budgets. So, if you thought about a project and you've sort of fleshed out what the needs are, how it will be implemented, who's going to be doing what the outcomes are that you'd be looking at, you're ready to start nailing down what your timeline and budget would be for that project. Now, they're both really quite important, right? So if you're going to propose this project to people, they're going to want to know, when are things going to occur? What's the order in which they're going to occur? And how can we plan around this, given our other priorities in the organization? They're also really going to want to know how much it's going to cost, right? Because that's the big ask for organizations that often have limitations on what they can spend money on. So they're making trade-offs and deciding between different possible initiatives that they could be pursuing. And you're going to want to be able to argue that that you have clearly thought through what the budget would be. And then secondly, that this is a good use of their money. All right. So I'm going to start off talking about timelines. So timelines are obviously an essential part of a project and project management, right? So they're going to help you with planning out how a project would roll out by actually forcing yourself to think about realistically what the time frame would be. As you're going through the project, it would help you to manage it, because if people are far off their timelines, then that shifts everything else with the project. So it helps you to sort of see how things are being implemented and making sure that the things that need to happen are happening, basically. And it's also really important to think about these timelines in terms of budgets, right? So if you need salary support for a year, that's fairly different than needing a salary support for 2 years, right? So the cost is going to change substantially depending on the time and time frame that you're doing things in. So these timelines really are tools that help keep us honest. When we're missing our deadlines, that helps us to sort of focus in on what we need to do. And sometimes we'll need to adjust that timeline, or sometimes we'll need to adjust what we're doing to speed up and approach a project more effectively. So there are different types of timelines that are out there. There are simple sort of timelines, and that's just where you list out the task and the time frame in which it's going to occur, and that would just be a list. You could also, in addition to that list, you could also sometimes add in a column which says who the responsible party would be for ensuring that that step in the process occurs, right? So for certain types of projects, that's helpful for also making sure that people understand which timelines each responsible party is individually responsible for. Another approach for doing this as a visual tool is a Gantt chart. These are used quite frequently now for project management. There's actually a range of different types of project management tools that try and keep track of time and keep people on task. This one is one that I see quite frequently used in projects. So, but there's others out there that might also be interesting or useful to you as well. So basically what this is you're looking at the different tasks, and then those are charted out in a certain time frame across months or years, right? And the scale of that's going to depend on your project. But it's a helpful visual tool for thinking about how things will occur and what the sort of cascade of different tasks is going to be. So budgets are also an essential tool for thinking about planning and management of a project, right? It's really important, particularly for getting a project approved, but also sort of keeping track of what you're spending as you're going through it to make sure that you don't go over your budget. Now, budgets, we often think about money as being problematic or a problem that we need to deal with because we all have restrictions, and that's also true. But money is also a value. It's also a way in which organizations can express their values. So ideally, an organization should be organized so that they are funding the things that they actually value. So when you're proposing a project, it's actually presenting what the budget would be is helpful for the organization to understand how they can value that project, how they can understand how that balances out against their other priorities, right? And that's a reasonable thing to ask of anyone who's asking for money. So why do we make a budget? Well, one, it's a communication tool, right? It's a way of talking through the project in a different way and talking about those priorities and what the resources are. It helps you to make realistic decisions about how you're going to implement a project, right? So some things would be perfect and ideal, and sometimes we actually have to scale back from what those ideal approaches would be just because they'd be too expensive, right? They also are tools for setting expectations of the people who will be responsible for using different funds wisely, right? So that makes it very clear in terms of what's available to folks. It also helps us to avoid surprising results. So if we think through the budget carefully and we think about each expenditure carefully, and we think about what the probability is that we're realistically going to actually be able to get things done with the money that we have, this can avoid a surprising result, such as getting halfway through the budget, through your project, and finding out that you don't have any money left and having to stop the project, right? So this is actually really important to be thinking about from the beginning. And it's also a method for assessment improvement. So if we're missing our budget targets, that sometimes can be an indicator that we're missing something. So that we're doing something wrong, perhaps, or that there's possible ways of being more efficient in that project. So sometimes it can reveal things in that sense as well. So there are actual real values to tracking the monetary component to these projects. So we're going to talk about some basic concepts in budgeting. Obviously, there's going to be experts who perhaps you can rely on to help you develop this in more detail, and each organization is going to have their own particular approach for these budgets. But it's helpful to understand what the basic concepts and components to a budget would be. So first off, I'll talk about strategies. So one is approach for coming at a budget. One is a bottom-up approach, and that's an approach where you ask different people who are responsible for different parts of a project to put forth their priorities and their expenses that they think they'll need, and then then you decide and you do trade-offs between those components. Very often, when you ask people to say what money do you want, you'll come in with more requests than you actually have money to provide resources for. So you'll have to do some trade-offs there. There's also a top-down approach, and the top-down approach is where essentially you say, we have this amount of money that we've been allotted, and we, as the people running this project, are just going to decide how much each group has, or each activity has. And that has some advantages in terms of time efficiency, but it can present problems in terms of perhaps missing important components to a budget, or perhaps getting buy-in where people don't get to say what they really need and have that conversation about how money should be allotted. There's also two major ways in which budgets are developed. One is what we could call a conventional approach or an incremental approach. And this basically takes a previous budget that had been allotted to an ongoing project, for example, and makes adjustments to that budget. All right. Now here, this is easier to do because basically you're just tweaking things around the edges to say, all right, well, we didn't spend so much in that area. We could probably cut that in the next year, or we overspent in this area. We need to add a little bit, or we have this new thing that we're going to add in and that needs to be factored in some way or another, right? Another approach is called a zero-based budget. And the idea here is that we don't assume that any money is being allotted to anything in particular. And we're going to start from the ground up and say, for each component to this project that needs money, we're going to require that you submit a proposal for each of those components. And you'll get what we can allot to that based upon your proposals and comparing those proposals to everyone else. And this essentially requires people who are making decisions about the budget to think carefully about each element to the budget, and each element has to be defended. So in theory, this is a better approach in the sense that it tends to be more efficient in terms of the use of money, such that you are avoiding spending money on things that maybe could be reduced in some ways, right? But it does require a whole lot of work, and to really justify each component to a budget every time you develop a new budget, often every year. So those are the major approaches that you should just be aware of in development of this. This is mainly relevant to projects that go on over a longer period of time, but it's also important generally to understanding how budgets work and the different strategies you could use. So budgets are made up of both revenue and expenses. So revenue is going to vary depending on the situation and what you're looking at in your context for your institution. But often when you're talking about projects, your source of revenue, your income, is really just going to be a request to that organization where you just say, we need this much money to do this thing, right? However, I would encourage you to not just stop there, right? When we think about these revenue sources, there's actually a real advantage to trying to think about whether or not there's a way that your project could also generate revenue. That first option was input from your organization, but is there something where by doing your project, you will actually bring in more payments from patients or insurance or other sources? Right? So that's a possible source of revenue from offering a new service, perhaps. Another possible source of revenue is grants. So maybe you're doing something new. Maybe there's an opportunity to apply for a grant that could actually support your funding for your project. Or maybe you're doing a collaboration with a community organization. Maybe they want to help provide money to support a project that you're doing. This is less likely, but sometimes sales or rental or services as part of a project can also be a source of revenue. So thinking about what those different possibilities are is fairly important, because when you're going forward to propose a project to the people who are going to make decisions about this, your stakeholders, administrators, for example, being able to say that there's a diversity of sources for money can help in those negotiations for getting an organization to put forth funds. So if you can say, for example, for your project that this would be funded also, say, by a community partner, well, that suggests that other people are buying into this project. And people, as we mentioned earlier, money is putting money towards something is also an expression of values. And we can, by having those multiple sources, it's showing that there is support and interest in doing this. So that is something that you should at least consider for your project, whether any of those types of possible sources of income or revenue might be available to you, because it could be important. The other component to this is expenses. There's different types of expenses. So some expenses are fixed, where, it's just going to cost this amount every year all the time. Some are wildly variable. So they might show up at certain points or not, and you might have some difficulty planning for it to some extent. You do your best to sort of estimate what that's going to be. And then there are some that are semi-variable. So these are things that, for example, that you'll have heating bills for your house every month, but they'll vary a little bit depending on the time of year. So, but you can still sort of plan around them and get a general understanding of what that's going to be, right? So knowing the different expenses that you have and knowing the amount of uncertainty, variability in that expense is actually pretty important for you in terms of your planning, because that helps you think about what levels of risk you have of overspending, right? So it's worth just being aware as you identify these expenses as to where they fall into that. Also, when you're thinking about your budget, thinking about what is your sort of essential things that you need in order to make a project run versus your wish list, right? So what are the things that would be ideal that would make it run as smoothly as possible, or have essentially the luxury of ideal services of various sorts. Now, when you think about your budget and what you're going to propose, you should think about, usually when people write these budgets, is they definitely include the essential ones, and then they also include some of that wish list items. You know, you don't want to go too pie in the sky with that, but you do probably want to add some of those elements in it. You don't want to bring it up to the point where it seems so expensive, what you're requesting, that people will just write it off immediately. But you also want to include some things that maybe if the institution really wants to invest in this, maybe they really want to do the best job possible with this and give you abundant resources, well, then that's great. Then you get your wish list, right? The other thing is that with adding some of those things in the wish list, that also gives people some things to cut. Very often when people look at these budgets, they're looking for places where they can cut possible things out of it. And in some senses, you're offering them some things that you're a little bit more flexible on. But you really need to know which ones are the essential, which ones are the wish list items, so that you know what you can negotiate on and what you can't. Generally speaking, when you're estimating your expenses, you want to pick a higher end of expenses, and for the previous, a lower end of income. And this is being conservative. It's really not to your advantage to go over your budget. That, especially if you do that regularly, that can become a challenge in a healthcare setting where people you'll start having trouble with getting support for your project, right? So this helps protect you from that potential outcome. One way to do this, as I mentioned, is being conservative. Another is to sort of pad, another term for this kind of is padding your budget, to sort of put things in a little bit higher, or put in things that may not be strictly necessary. That gives you some wiggle room so that you can say, oh, I actually made it in under my budget expectations for this project. So what types of expenses are you looking at for a project? Well, covered in the project would be the salaries and the wages that for everyone who's working on it. Everyone who's working on it is going to be spending some time on it, and it's worth factoring into that what the cost of that time and effort would be. Right? You'd also look at fringe benefits of various sorts for those people who are involved. You'd think about whether or not you need a consultant to work with you on a project. So, for example, are you going to be doing this statistical analysis? Do you need to pull in a consultant to do that work with you, or an expert in certain area of intervention that you're interested in? Do you need to buy equipment for your project? Right, that can be expensive in various different ways. You could also think about supplies of various sorts. So that could be medical supplies. It could be things like pens and pencils and stuff like that. You don't necessarily have to list out every single pen that you're going to be buying, but you do want to get a general idea of what you would actually need to make this run. And sometimes those supplies can add up. If you're thinking about having a widespread poster campaign to promote your project, well, posters actually cost more than you'd think to print out lots of those. So it should be something that should be part of your budget. Sometimes you'll have travel if you're implementing your project in places away from where you are, or you're needing to go various places to, say, gain expertise around a certain set of skills. And then you might have contractual costs for your organization or for your project, for services or space or other things like that you need to have covered by your budget. Facilities and administrative costs. Sometimes these are indirect costs that could sometimes be added into budgets, where essentially they expect that you have a certain amount of money budgeted for the space that you're using, and for the cost of the administrative elements of dealing with that money and the organization of your project. So this is often seen in research. It's less likely in a project, but it may also be something that you'll be charged for. And then there's a wide range of other things, and that's going to be dependent on your project itself. So these are things to think about. Now again, this is valuable because what this does is it forces you to sit down before you do your project to really think about all the different elements of things that you would need and to really list them out and figure out what is realistic for your project. So thinking about this carefully and thoroughly is going to be to your advantage if you're going to try and do something. Now, when you present a budget, it's often the case that they will ask for a budget justification, right, or expense justification. Okay, so this is where for key expenditures, or especially expensive, high cost expenditures, they are essentially asking you to say, what is the thing that you're asking for and why are you asking for it, right? So if you're asking for a whole new line for a staff member, for example, well, that's actually a fairly high expense, and they're going to want to know what it is that that person's doing and why they're needed and why somebody else can't do it. So these justifications tend to be fairly short, maybe 3 sentences or so, but that's going to depend on your organization, and you'll see that. So this can give you sort of information about what that's gonna look like. And up at the top, you see that there's some, basic information about what this would be. So that's what a budget justification is. Now, you also would want to write out a budget, and that budget would be a combination of your revenue and expenses, and ultimately resulting in total. So usually when you're writing a budget, you're typically, at least first off as you're planning, you're talking about your estimated costs for different things. Now, in terms of revenue, very often you're going to be requesting that from the hospital that you work or the institution where you work. Maybe you have a grant, maybe you have some other sources of revenue, but think about what you can add in there possibly. And then you have your expenses. So your expenses are going to be things like the wages and supplies and consulting, etc. Right? So, and then your total would be how those balance out, right? So one thing to note here is that what you can actually do is when you're doing a project is you can actually keep track of how much you spend for those different things. And that would be where you would put in how much you spend for each of those line items. So the variance is essentially the difference between your estimated and your actual expenses, right? And we'll talk a little bit more about that in a second. You should also put in the percent of your overall requests that each of these elements are, because that's just kind of helpful for looking at these numbers. You want your budget to be balanced, right? So you want it to be something where the money that you're bringing in matches the expenses that you have at the end of the year or whatever time frame you're working with. Now, sometimes you have the opportunity, if you have extra money, to hold on to that money and use it in a later year. That's not always the case in healthcare settings. In fact, it's not. It's often that goes back into a general fund. But it's worth noting that it's valuable if you can come in under budget, because that allows you to keep funds for later years when you might need that money more. Now, there's another possibility in terms of your budget, which is that you come out and you spent more than you anticipated. And sometimes that means that you're going to have to request more money from your organization, or sometimes it means that you have to cut out things that you've been using in your project. And that can be very difficult. So that is, having a budget deficit is something that you really want to avoid, of course. So variance analysis, again, is a difference between your estimates and your actual expenses. So the value to this is that when you see the difference between what you expected and what you spent, this gives you ideas for possibilities for organization, effectiveness, efficiency of implementation, things like that. So this can be a very useful thing to do in settings, and a lot of healthcare systems do this because it actually does increase efficiency of systems. So you often see this type of thing done. All right, so what is a business plan? So when you're developing your project, you will think about what your timeline is, you'll think about what your budget is, And based upon that budget and thinking about, the different elements to your project, you can come up with an argument for your organization to say, here's why this makes business sense for this organization. This is why this is a worthwhile thing for us to do, right? Now, for a lot of health interventions, it's actually going to cost, at least immediately when it comes to your budget, it's going to cost your organization money. You're going to request a certain amount of money, and they're going to give it. They're going to give it to you, and you're going to use it, right? So it's going to be expenditure on the part of your organization. What you have to do is convince them that it's a worthwhile investment. It's good business to do this thing, right? So you can make that argument in multiple ways, right? You could say that, you could potentially say that the overall costs pay themselves off. So perhaps you do, by putting this forward, you actually will start getting a different type of income. If you start a new program that expands the services that can be offered, well, sometimes that can bring in new money, right? It can also be that the value of it is worthwhile, right? So it might not necessarily immediately directly bring money, but sometimes moderate expenditures can actually make a big difference for health of the patients and well-being of patients, or well-being of nurses and staff, right? So sometimes it's valuable to put out money, even if you don't necessarily directly or in a way that you can observe, bring that money back, right? Another way to argue this is sort of various types of savings that could occur. So in terms of reimbursement, in terms of long-term having less readmissions, right? Or having losing less staff due to loss due to lack of satisfaction with their work, right? So there's different ways that you think about this. If you think about your project as doing something good, try and think about what the monetary benefits of that are in the long run, and try and figure out whether you can find any information out there about what that value might be. There's actually a lot of organizational data out there about, for example, the cost of replacing one nurse is actually quite expensive. I think it's around $60,000 to go out and hire a new nurse. If someone leaves because they're not satisfied, right? So if you think about this carefully and you think about the benefits of your project, this allows you to assemble an argument preferably from multiple directions as to why this is a good investment and worthwhile approach for this organization from a business perspective. I have a colleague who basically says that if you have a project and you don't have a business plan, you don't have a project, because in healthcare, it's very important to actually have that be very clear for people who are making decisions about how funds are spent. All right. So that's some thoughts about how we think strategically about different elements to a project, and essentially implement or create frameworks that keep us honest in terms of the timeline in which we're supposed to be doing things and the amount of expenditures that we're going to be putting out for making things happen. And this is, of course, going to be really important for both getting your project approved and also maintaining your project over time. So a lot of these projects are hopefully things that will be ongoing, and thinking about that carefully from the outset is going to be quite helpful for you overall. So these are just some things to think about. I hope that was helpful for you. So that's about it. Take care, everyone, and be well.